Hey, family, how are you? God bless you, and thank you for tuning in to another exciting show of Senior Talk with Clara Hubbard, your resource and information show for people getting better with age. Well, we're very excited for today's show. We are in the month of April as we are celebrating National Healthcare Month, National Minority Health Month. Oh my goodness, excuse me. So what we're going to do now is we're just going to play a quick commercial break from our Cook County Treasurer, Maria Pappas. She has a great promotion that she's using through our platform here at Senior Talk Media. But we do ask everyone, please post, share, tell your friends. It's 12 o'clock noon Central, 1 p.m. Eastern. Senior Talk is live. We look forward to seeing you on the other side of this commercial break. Everyone, stay tuned.
Hi, I'm Maria Pappas, Cook County Treasurer. Property taxes are due March 2nd, but there's no late fee through May 3rd. Go to cookcountytreasurer.com, put in your street address to pay online, search for $76 million in double payments and $46 million in missing exemptions. See if your property is on the tax sale delinquency list. Put in your address at cookcountytreasurer.com.
All right, everyone, please be mindful that our Cook County Treasurer, Maria Pappas, is on it. So please be mindful. Go to Cook County Treasurer. She's returning funds to people, and a lot of families are being blessed. So what we're going to do now is welcome our special guest. Good day. God bless you. How are you? The word that I found out for you is Doctorpreneur. How are you this morning?
Hey, that's a new one. Great to meet you, Ms. Hubbard. Glad to be here.
It's my pleasure. Well, as we're telling everyone, this is National Minority Health Month. I have the distinguished honor of welcoming Zing Health, myzinghealth.com. Let me tell you, it's an exciting time for our community. And what other way to welcome them during what? National Minority Health Month. So what we're going to do now is I just want to play a little small excerpt from your commercial. You're doing great things in the community. We're going to come back and get to the meat of our time here today. And everyone stay tuned. Don't forget to tell your friends. It's 12 noon Central, 1 p.m. Eastern. Senior Talk is live, and we're here to serve you. God bless you, everyone. Stay tuned to this quick commercial break. Oh, my goodness. This is a beautiful time. I'm so glad about this. Let's get it started. Here we go.
Zing Health is turning 65 and dancing the night away. Zing is getting your extra steps in. Zing is your trusted partner helping you navigate the Medicare maze. At Zing Health, we listen patiently to your health needs, personally guide you to the best Medicare Advantage plan, help you maximize your benefits so you can start optimizing your health today. Are you turning 65? Amazing starts here. Explore how Zing's Medicare Advantage plans help you feel amazing. Call 844-ZING for us or go to myzinghealth.tv.
All right, everyone. So that was a commercial from our good friends at Zing Health. Welcome, our good friend now. And we're going to go in the community together and serve and be of service. I'm so excited.
Yes.
Dr. Eric E. Whitaker, let me tell you, busy man, thank you so much for joining us today. But I want to go back to, you got a great bio. It's not too many people you have not touched. You have some great terms that we're going to speak about. I want you, now that it is Minority Health Month, I really want you to talk about your being a founder in Project Brotherhood, that Black men's clinic. I think we need to focus more on men and the betterment and quality of their lives. So would you just share that information about the clinic itself?
Sure. I think it's helpful to understand some of where I'm coming from too.
Yes, please.
And, I like to say that I'm a Southsider by birth and by choice, and I'm steeped in the South Side. The South Side, I'm a son of the South Side, yes. And as I became a physician and got a better understanding of the health disparities and the statistics. I finished my training and came back to work at Cook County Hospital, and in particular did work at a clinic in Woodlawn called the Woodlawn Adult Health Center. And so as I was preparing to do my work there, I looked at the life expectancy statistics, and there was a 14-year life expectancy difference between Woodlawn for Black men than white men in the rest of the city of Chicago. 14 years. And you'd have to go to like the when Russia was falling apart, you'd have to go long distances to underdeveloped countries to find that sort of disparity of life of statistics. And so, back in the late 90s, we ended up, I was there at this community health center, and it turned out that men weren't visiting the clinic. So we took a page out of the marketing that others have done, and we went out and actually talked to Black men and said, hey, you got this resource sitting right here. Why don't you use it? What would it take you to use it? And we found some surprising things and some not so surprising things. Mm-hmm. The first thing that wasn't so surprising is that the men saw it as a place for women and kids. They didn't see it as a place for them. The other sort of surprising thing was the fact that, while we saw the fact that the clinic was in the community was a benefit, that was the best thing about it, but that was also the worst thing about it. Mm-hmm. Black men didn't want folks to see them come into the clinic lest they be seen as sick or weak or other things. Yeah. And so then we moved from doing some basic marketing research and said, how do we create this place so men would come there? And we ended up starting Project Brotherhood. All of the physicians that practiced there were African-American men. The social workers were African-American men. We put a barbershop in the clinic where men could get free haircuts. We started a rites of passage program out of Project Brotherhoods because we had the feeling that even though you might be 70 years old, you're not a man if you're not following the duties of what men should do. Sure. And we did a parenting class for men, which before I had kids, I went through the parenting class at Project Brotherhood. And the important thing is the African-American doctors that were there participated in all activities as Black men, not with our title or our status, but as brothers coming together to talk about topics. And we were ahead of our time. Mm-hmm. We were the first in the country, and people came from all over the country to look at what we were doing because they wanted to replicate it back where they were coming from. But we were lucky enough to have the backing of Cook County Hospital, and because all of our patients were uninsured. Sure. And so unless you had a Cook County Hospital to back you, you couldn't replicate this. So this started on the south side of Chicago and unfortunately didn't get spread across the country like I think it would if the Affordable Care Act were in place when we did this.
Yes. Wow. Well, the good thing that I'm hearing is, and what I really appreciate is you created something called the doctor-patient relationship. Mm-hmm. So that you could identify if this is the service that I'm going to provide for you, mm-hmm. How do I welcome you? And it should be duplicated because men have to have a different variation of receiving medical care and be comfortable with it. So having the additional services was definitely bar none. So now let's talk about you have this career with Illinois Department of Public Health, Cook County Health Systems, and now we are in a pandemic. Praise Jesus.
Yes.
I greet you still with my mask. We must keep our mask on to save lives. Absolutely. That's very key. I have to have one of those. So let's do this. We want to talk to, and we're dealing with Minority Health Month, and Zing is going to come back multiple times through our network. Let's talk about the disparities are still going on through this pandemic. How we are not addressing our personal, we're just trying to stay safe and get home. But there are still things that we need to continue to increase our quality of life. So how do we address our disparities through a pandemic from your eyes, doctor?
Well, I mean, the truth of the matter is that, the fact that Black folks have been dying disproportionately and getting sick of COVID compared to others really just unveiled the fact that there's been disparities in healthcare that existed all along. And the sort of diseases that Black folks have more than other folks, like hypertension, diabetes, lung disease, asthma, COPD, which stands for, I'm like blanking on the actual acronym, but we have these underlying conditions that existed before COVID came, People were acting like, this is some surprise that we would get COVID much more than other populations. So I mean, we have to deal with COVID. Take it seriously. I'm advising people to get the vaccination. I've had my 2 vaccinations, and people are concerned about whether or not the vaccine is something to be scared of. All I can tell you is that if you go in our communities where vaccine is available, you see whites and others coming to our neighborhood to get them. So
you're on my street. You're on my street. Okay, here we go. So I currently am in Indianapolis. I'm building my network nationally, and so I'm in Indianapolis. And one of the things that really was amazing is that I call my family and they say, Clara, what is going on? I'm like, what do you mean? My aunt said she had to wait at a particular hospital on the South Side because there were so many other ethnicities getting the vaccine. Coming from North, not living in the zip code, it's just overwhelming. And so it's important too that they can't hold the vaccines for too long anyway. So we need to be mindful that if it's in our community, you should take advantage of it. But it just deterred me because there was such a line in Roseland Hospital.
Yes, I actually grew up right around Roseland. So
we may be cousins because I grew up on 117th. I'm a product of Roseland.
Okay, so I grew up on 112th and Racine.
Okay, I was on 117th in Michigan.
So that's I was telling my daughter who got her shot at Roseland Hospital that when I was in high school, I got actually jumped and pistol whipped by Black Gangster Disciples, 3 blocks from Roseland Hospital, and they took me to the hospital to get sewn up, and I would have had a big scar across here and back here, but for Roseland, sewed me up and sent me back out. So Roseland has a lot of history in my family.
I heard that. That makes sense. So what can the community do? You're starting, let's be mindful. Zing is less than 2 years old.
Yes. And
you're in the height of a pandemic and you present Zing Health. I think you started in 2019.
Yes.
What was that like? How did you sustain and get to this point now that we're seeing a little light? It's had to have been a tough ride for you.
No, you just don't know, Ms. Hubbard. This time last year, we could have gone out of business. I literally was raising money payroll to payroll. And then in May last year, praise God, we got $150 million investment. But literally, we could have been out of business. And we cared about 80% of our members are Black or brown, mainly Black. And when we sent out a COVID care package to every person that had a thermometer, a pulse oximeter, so you could check your oxygenation level, an information booklet about the gave data, health data about COVID-19, and we sent them a mask. We sent that to every one of our folks very early in the pandemic to make sure that people knew what's going on. And currently, we're contacting all of our members to make sure that they've gotten vaccinated. And if they want to, and if they don't, we try to give them good information to try to convince them to get vaccinated. But it was a hard time to try to grow a business because everything was shutting down. People were scared. And I was the head of the state health department here in the state. And I was one of the people who prepared Illinois for a pandemic. Okay. And so I had a healthy fear of what was going on myself because I've seen all of the models, the numbers, and I took it very real from last February to today.
Wow. So Zing Health is making a great stride. Let me say, I know some of your consultants very well, and you've picked a very, very, very powerful team. You got to have people with experience. Let me tell you, I'm very excited for you. Now, with that being said, there's a term, and I've read it, and I've seen it, and I've heard you speak it publicly, but Zing is the visibility, we plan to be a training ground for our minority healthcare executives. Yes. Tell me, what does that look like for you?
Well, currently right now, about 80% of our 58 person staff is Black. The thing that's true is, you can't be what you don't see. You can't go down a career path if you're never exposed to it.
Yeah.
And I wouldn't be a doctor today if when I was 15, 16, I saw a Black physician for the first time and said, you know what, I want to do that.
Yeah.
And so we're being very intentional about, who we bring into the tent in terms of our team. My hope is that people understand entrepreneurship from seeing us do it here at Zing, and they go out and start their own companies, because we need to have an ecosystem of Black founders that can grow businesses of scale. Because you know what, when you look at the data, Black folks hire Black folks, and my wife, who's a physician, and we this is the third company I've started in health insurance company. And usually when we go to meetings, we show up with our crew and we bring the diversity to the meeting.
Hey.
And oftentimes we're talking about our people, and there's no one else in the room that has the experience and the background that we have. So I'm hoping that over time that people get trained here, go elsewhere, and become leaders of other organizations, or importantly, start their own.
Absolutely. So let's talk about the Zing system. I mean, you have some programs that, like, I'm hearing, and what I love is that you send packages to your team and to your patients to say, hey, we're not going to see you right away, but here's some things. We're still thinking of you. And I think that is, let me say, this is key. One of the key things that all of my community of seniors are saying is that they had no communication, i.e. with maybe their doctors, physicians, or family. So now we're all isolated.
Yes.
Isolation is a big thing. So the fact that you sent the mask and had a package to say, hey, we love you, we're here for you still, is a big deal. Now, I know that you have something that is very unique, is this telehealth program.
Mm-hmm.
Oh my gosh, people are loving telehealth. We have to get comfortable.
Yes.
Let's be clear. Some of us, well, who are we talking to? You're talking to a professional. So tell us about the success of the telehealth program that you have.
Well, certainly there's been an explosion of telehealth in this COVID environment, because people were rightfully scared about going to see their primary care doctor or their subspecialist. So we offer the ability to connect by phone or by video with specialists or nurses or others who can help you stay on the right pathway in terms of health. And my hope is that as you're suggesting, we have to get more comfortable with the technology, so that we can, instead of running to the emergency room where they try to deal with a problem and be done with it. We want people to not have these episodes of care, but to have continuous touch points with their health team, so that they can continue to get the information that they need to make the right choices and get the care that they need.
Absolutely. So I'm all excited. I have a few family members who are, we don't call them seniors, we call them people getting better with age.
Okay.
But
that's a long thing to say, Claire.
I'm telling you, if you go in a room and say and use that term, they're going to cheerlead. I have gone to play. Well, I'm not a senior, that, but you're getting better with age.
We need to get a shorter thing to say. If you can find that for me, that'd be helpful.
All right, I'll work it out. So let me say this. People are really excited. I've talked to some of your team members, and you have a very unique program in regards to, I think you're working with heart health, and there's so many things that people don't address. So if you can you give me a little umbrella of what's under Zing Health?
Okay. Yeah, so we're what's called a Medicare Advantage health plan. As most people think about Medicare as an insurance program that once you hit age 65, you become eligible for it. And we're a type of plan that you can get. It's underwritten by the federal government. Importantly, people earn the right to be on Medicare. We pay, all of us who are working into it. This is not welfare. You paid into this.
You might want to say that again. You earned it.
Yeah, you've earned this. And the important thing is, original Medicare, what they do is you go to the doctor, they pay the bill. but they don't look holistically at your health. What
Mm-hmm.
Medicare Advantage allows us to do is to look holistically so we can work on your vision, your hearing, your dental. We can offer supplemental benefits like transportation, those devices that go in the bathroom for safety. We can help get those put in your house. There's a whole list of benefits. And Zing Health itself has a traditional HMO, health maintenance organization, but we also have something called a special chronic special needs program. So for those who have diabetes or who have cardiovascular disease, heart disease,
Mm-hmm.
or heart failure, we have a special plan that helps get even more additional support for people who have those chronic conditions. And we tend to have those chronic conditions more than other populations. So we and again, this gets back to, why do we get in business for Zing? We want to help improve our community and be a trusted source of information, because there's a lot of craziness out on the internet, and even my family, they talking crazy. And so I have to say, whoa. I went to a lot of school. I went to the 24th grade. Let me, what grade did you go to? And then we walk it through to try to get the right, correct information in front of people.
Okay, so here's what we want to do. We want the community at large. We know there are a lot of churches that are soon to be opening up. I am asking, if you are watching and through my network, please call the Senior Talk office so you can get this information. We need to make sure that our faith-based communities, when the doors are officially open, that you look at services. A lot of you have health ministries and you haven't maybe got together to put something, use this platform through Zing Health as well as Senior Talk to get some concrete information and talk to experts, because we're trying to self-diagnose and that does not work.
Yeah. And one other point I just made clear. Medicare is a complicated thing. And what we want to do at Zing is to be a place of good information to discuss your options. And at the end of the day, if an individual says, you know what, this is not for me, I'm good with that, because we will have done our job in trying to educate folks. When you look across the country, only 18% of Black folks pick this Medicare Advantage option, this more holistic option, whereas about 40% of other populations pick it. So we've not taken our advantage of Medicare Advantage at all across the country. And so again, we want to expose people to the options. And if they want to go somewhere else, I'm all for it, because I don't want you on our plan if we're not the right plan for you.
That's right.
If you think there might be a problem with it.
Okay, so here we are. You've already addressed a few things, but there are several plans, as you mentioned.
Yep.
What is that one standalone that Zing offers that maybe your competitors does not?
Well, this chronic special needs plan, it's something that we offer that not a lot of the big plans do. They don't put an emphasis on it. And we're currently in Illinois in 6 counties, including Cook County. We're in Indiana, in Marion, like in Indianapolis, Allen, and Lake County. And we're also in Michigan, in Wayne, where Detroit is, Genesee, where Flint is, and Oakland County, where Pontiac, Michigan is. So we've expanded from just Cook County in year one. We're in these other counties, and we're going to expand some other like 4 or 5 counties going into 2022.
Absolutely. Well, we definitely welcome you here to Indianapolis. I'm in Chicago often, and we work with the Indiana Department of Minority Health. So there's definitely, a lot of room to grow and to bring that. I mean, what's going to be critical is what you mentioned, that special need program, because of the intensive care as well as the extensiveness of it. I haven't heard that, so I'm very excited about that. So now we're closing out real soon, but what do you tell our community at large in regards to just the changes you've seen through your career with the Illinois Department of Health, working with the universities and hospitals? What have been the changes, and how can we be better patients?
Well, I'm a primary care doctor by training, so internal medicine. I would urge every senior to get a regular doctor, someone you trust, someone you can go to for good information. There's data that shows that even just doing that, people have better outcomes than not. Because again, it saves you out of the emergency room. You get all of the preventive services that you need over time, and it keeps you out of hospital. Because one of the things I like to say is people get sick in hospitals, so you want to stay out of the hospital,
right?
So it's our job at Zing Health and working with your primary care doctor and your specialist to make sure that you get all you need. But knowledge is potential power. So you got to know right, but you got to do right too.
Right. Absolutely. And I think what we're going to do is we're going to also revisit another interview in this month of April for Minority Health Month. I think we're going to be talking with the special needs team, some of your experts, because we want to put faces on people who are going to be serving us.
No, that's phenomenal.
We're going to do that. But if I could, I just want to play your commercial once again for the people who are watching on YouTube and Facebook. We appreciate you. And to all who are making comments, I appreciate you so much. And everyone stay tuned. This is another commercial break from Zing Health. Stay tuned, everyone.
Zing Health is turning 65 and dancing the night away. Zing is getting your extra steps in. Zing is your trusted partner helping you navigate the Medicare maze. At Zing Health, we listen patiently to your health needs, personally guide you to the best Medicare Advantage plan, help you maximize your benefits so you can start optimizing your health today. Are you turning 65? Amazing starts here. Explore how Zing's Medicare Advantage plans help you feel amazing. Call 844-ZING for us or go to myzinghealth.tv.
All right, everyone. Let me ask you this. This is my Zing TV. Should I be on that channel?
That's it.
What? I got to get on that channel. Oh, my goodness. But I just want to say, Mr. Whitaker, honestly, it's a pleasure to have you. And, I've seen your name multiple places. You've been philanthropying and just helping the community at large. And you're really a champion for health and for our community. So I just want to say thank you in advance for your time today. I know you're normally on roller skates, so you sit still, and I appreciate it. And we want our community at large. Thank you for the comments. We're going to be asking people to share this with your church ministries, hear the information. The owner and co-founder is here. The CEO is on the line. He's with us. And more importantly, you have a passion. It comes through that you have a passion for our community. And I only appreciate you even more in depth because you were a child of Roseland.
That's right.
We they say I had lots of school.
Yep. Lots of school. I have to tell my kids sometime when when I have to check them. Like, I've been around the block a little bit.
That's most appreciated. So the future of Zing is bright. They're serving Indiana, Michigan, and Illinois. Mm-hmm. And where else those are the three states we're in right now, correct?
That's right. But we will be in the Midwest, and hopefully we'll be across the country. But I mean, again, we're trying to build a company that our community can be proud of, and also be able to get to scale. Because one of the things, we have these little things that happen, but we need to have a company like an Aetna or a Humana, and we could be that vehicle.
Absolutely. So everyone, don't forget that information you see. The website is there, myzinghealth.com. But I am asking you, if you're viewing, for those who are responding, go to Senior Talk Media, check us out. Let us be a source. We'll put you in touch with some of the local persons who can assist you. We're also asking for health ministries at large, community organizations. If you're doing a blood drive, anything that's outdoors and safe, they got masks. They will come presentations and also be informative. And that's what we want to have, because we don't sell, we inform people. And that is our goal, to make sure our community is one together at large and knowledgeable as well. So it's been a pleasure to have you, Dr. Whitaker. As we say in closing, in complete darkness, we are all the same. It is only our knowledge and wisdom that separate us. Don't let your eyes deceive you. I've been your host and granddaughter in the community, Senior Talk with Clara Hubbard. Our co-host today was none other than Dr. Eric E. Whitaker, the Doctorpreneur. God bless you all. Thank you for making this a part of your day. And we will see you next time for Senior Talk with Clara Hubbard.